Hello viewers, welcome to this episode of Healthy India. COVID has dominated our health-related discourse for the last 2 years. Not just that, it has impacted our life in numerous ways. In this program itself, we have discussed treatments of COVID, the science behind Omicron, impact on lungs, issues regarding diabetes. But one issue that we haven't discussed enough here is the issue of mental health in COVID. Now, one may argue, why are we discussing this now? Because we think and we hope that the pandemic is on its way out. And the reason for that is that mental health issues related to COVID continue to persist after COVID also. And some of them, in fact, have appeared after COVID, and children have joined school, people have gone back to office. So there are multiple issues. And as usual, to discuss that, we have eminent experts in the studio with us. We have Dr. Rakesh Chadda, who is the Chief of Psychiatry at the All India Institute of Medical Sciences. And we have Dr. Rushi, who is the Chief of Psychology at the Atal Bihari Vajpayee Institute of Medical Sciences, RML Hospital, both from New Delhi. Before we go on to COVID, Dr. Chadda, I'd like to ask you a little bit about mental disorders, just in brief, because people sometimes they think of it as something esoteric and it can't happen to them. So are mental disorders common? What is their overall prevalence?
Yes, mental disorders are very common actually. In fact, recently we had National Mental Health Survey of India, whose findings came in 2016. This was conducted at 12 cities, 12 places. And we found nearly 10.5% of general population suffers from some kind of mental illness. Now, when we talk about the mental illnesses, this also includes substance use disorders like alcohol, tobacco and other substance use. And if we include substance use disorders, this number goes to nearly 30%. Now, one of the biggest problems with mental disorders is that a large number of people don't access any treatment. Nearly 70 to 90% of the people don't go for treatment, because many times it's because of lack of recognition, lack of awareness. So there are so many reasons for. So it's very important. Mental health is very important. In fact, it's a key component of health. The other two components being it's a part of the well-being. So it's very important to take care of your mental health.
So as we know, health is not defined as not just physical but mental health also. So it's pretty important that we do focus, and it's very important that we recognize and don't run away from it. And it's like a condition that could happen to anybody, like we do for other diseases. In the same way, a disorder or a condition or sometimes a full-fledged disease, but we would want people to understand that mental health problems are not uncommon. You're not sort of singled out for having such a problem, and many people have to face them and deal with them in their day-to-day life. But what are the broad groups? Because mental disorders means a lot of things.
Yeah.
What are the broad groups?
Yeah, simply we can group mental illnesses in two big groups. One is the severe mental illnesses and other is the common mental illnesses. Now, severe mental illnesses include schizophrenia, mania, bipolar disorder, which constitutes maybe prevalence is maybe around 2% of the general population.
Which is still very high.
Yeah.
2% of a population like India.
Yeah.
Is a huge number.
Yeah, that's
right?
a huge number.
Yeah.
Yeah. Then the common mental illnesses, which includes anxiety disorders, depression, and phobias. And this group includes this has prevalences nearly 9 to 10%. So that's a very huge figure. And large proportion of these, the common mental illnesses, the patients, the persons don't go for treatment, because often the illness remains unrecognized. Though this is a common mental illnesses, but despite that, these are also very disabling, especially if the treatment is not started at right time or in the early phases of illness.
So it's very interesting what you're saying. The prevalence, you said it in the recent survey, also showed about 10%, which is actually maybe a little higher than even diabetes. Is something that I deal with. And we always say India is exploding with diabetes, and it's surging. So mental health issues are very important and very common. But why don't people seek help, Dr. Rushi? I mean, this is one challenge that we are facing.
So very true. Like sir was mentioning that, the treatment gap is 80%. So like 80% of the people in India who have mental health issues, they don't access mental health care or the mental health care services. So the reason behind is, the major reason is the stigma and negligence, lack of awareness. So the people are not aware that, you know, these are the issues, they can seek help or the treatment is possible for that. So lack of awareness is very common. Negligence is very high in India. That is with regard to the physical mental health issues also. It's not only that it is related to mental health issues, but when it comes to mental health issues, so a lot of stigma is associated with that. So people don't want to access the services, they don't want to go to the professionals for the help. So I think that is one area which we need to address as a, you know, in the community. So that's why community mental health programs are very much required. So because see, we are working at the tertiary care, so we have seen that very few people, they access to tertiary care services, especially when it comes to the children and adolescents. Then the number is obviously very less. So because, you know, this is the period when 50 to 75% of the mental health issues, they just emerge by this age. So, and the parents and the teachers, they are not aware that, you know, they should access the mental health services, they should access the help. So that is the one area that this is the, you know, this is the area which is neglected. And among the adolescents, adults, I mean, it is affecting the people almost across all the ages and gender and communities. So I think because of the COVID-19 also, besides the, you know, devastating healthcare impact or the high mortality rate, so it has seriously impacted the mental health issues of people. Like sir has mentioned, that depression, anxiety, you know, the panic attacks, those were increasing. So a lot of teachers who were coming to the tertiary care centers, that they were having panic attacks because, you know, there was uncertainty. So a lot of panic was there. So the whole education system was impacted because of that.
We need to look at the whole picture carefully, and it's what is emerging very clearly is that there is need for greater awareness.
Yes.
मानसिक रोग से हमें भागना नहीं है, उसका इलाज संभव है. तो अगर ऐसा कुछ है आपको या आपके परिवार में, तो ज़रूर मदद ले डॉक्टरों की. कई बार ऐसा होता है कि आपको वो सुविधा ही ना हो, बहुत दूर रहते हैं, थोड़ा प्रयास करना पड़े. ऐसा भी होता है, इंडिया बहुत बड़ा देश है, गांव में तो सब जगह सर्विसेज नहीं हो सकती इसकी, लेकिन फिर भी उसकी पहचान करके मदद लेना बहुत ज़रूरी है. और अगर हम नहीं करेंगे तो आगे जाके हमारी लाइफ पे पूरा ही इम्पैक्ट पड़ सकता है, हमारी लाइफस्टाइल पे, हर चीज़ पे, दैनिक चर्या पे, हमारी जॉब पे, हर चीज़ पे इम्पैक्ट पड़ेगा. इसलिए ये ज़रूरी है कि हम भागेंगे नहीं. अगर कुछ है प्रॉब्लम तो उसको टैकल करेंगे, उसको ट्रीट करेंगे सही तरीके से. जैसे कोविड-19 आया, आपने जिक्र किया ऋषि, इट रियली चेंज्ड एवरीथिंग फॉर अस endocrinologists. It had a huge impact on diabetes. You know, it had such a big impact on health. We know that people after COVID is also struggling with breathlessness, with fatigue, with so many things. So overall health of the population has been impacted by COVID. And a further spin on that is that if you have poor underlying health, I'm talking of general physical health, poorly controlled diabetes, high blood pressure, maybe some kidney, heart issues, then you are much more likely to be impacted adversely by COVID. So our baseline health makes a big difference. But as I said, we are now today talking not just of the physical aspects, but of the mental impact of COVID-19. So if I was to ask you, Dr. Chadda, about the overall impact of COVID on mental health that you have seen and studies have shown in the last 2 years, how would you sort of, because there have been many issues. I mean, there's simple apprehension, there is fear. You know, I know of my patients who are so scared that they may get COVID. Some of them just kept themselves confined to one room for 2 years. There is social isolation. People not able to interact. That has an impact. Loneliness. Then people have lost loved ones. You know, they've lost. It's so tragic that, and not being able to even sometimes give them a proper, I should say, dignified death. You know.
Yes.
So all those kind of things are there. and jobs,
Yeah.
finances. You want to expound on that?
Yeah. So broadly, if I say how COVID has affected mental health, it has gone through 3 phases actually. One phase was the initial phase when there was lot of fear of COVID, kind of panic. There was lockdowns and there were businesses were closed. Many people became unemployed. And in addition, the constant fear that there is no treatment. So that lead to a kind of community phobia, community fear. And so that was the, and people were locked down, could not access, schools were closed, educational institutions were closed. So that was there. In fact, some suicides also happened during that period in that background. But the other is the people who developed COVID were isolated, had to go into quarantine, the family members had to go into quarantine, social isolation. Then many people lost their near ones. So they could not say a proper goodbye to their loved ones. Sometimes all of us have faced that one family member has died and the other family member is admitted, and many children lost parents. So that kind of thing has happened. And then some people developed complications of COVID, the mental health consequences of COVID. So that also we have seen. Now in the recent period, like last 1 or 2 months, as educational institutions are opening, other establishment offices are opening. So now people are finding difficulty in coming back because their habits have gone into
Changed.
like they have lost that habit of getting up in the morning, and so that thing, because COVID had led to a very erratic routine, and then it brought social isolation. People have clung to the social media, and this clinging to social media has its own adverse mental health consequences, also physical health consequences, because people did not go for outdoor exercises, physical activities were stopped. So all these things have led lot of issues. Now children are facing problems, and parents are struggling with children to send them to schools, because children have lost habit of sitting in the classes, getting ready in the morning. So there are so many things have happened. So all these have together, because now we are facing, and there is also a fear of the next pandemic, next wave. That's also there. So it has led to lot of adverse mental health consequences, which we need to, people whosoever is getting some problems, they should access services. And it's another thing I would like to say, that it's not that for all mental health issues you need to go to a psychiatrist. One can, your family doctor, your physician, your family physician, everyone is equipped to deal with the common mental health issues. If he or she is not able to deal with the common mental health issues, the person would refer you to the psychiatrist. In addition, we have now district mental health program covering almost all the districts across the country. So access is available even in all over the country, even in the remote areas. Some kind of help is always available. So one should not fear going to a doctor, if you have a problem, you should access your doctor, and the person would be able to refer you to the proper service if he or she is not able to provide help.
I think those are very, very important points. The reasons for problems during COVID or aggravation of mental health issues during COVID, one study said it went up by 25%, anxiety and depression. So have been neatly outlined here. And the fact that the mental health network is now expanding in India, and the fact that district health services are available, and the very important fact that for all routine mental health issues, you don't need to see a specialist all the time. And that's very important, just see your doctor. I think that's a great idea, a great concept, which sometimes people don't understand because they think now it's a proper psychiatric problem. Some of them may just need a doctor, some may just need counseling, psychologist. One area where we've all been really worried is about our children, about the fact that firstly children were sort of at home, almost isolated, or only with their tools, electronic tools, for 2 years. And now they're having to go back to school, obviously. So during this whole thing of isolation, COVID, and then now getting back to school, they are one of the worst sort of sufferers, if I may say, because their education is directly impacted, their brains are growing, and whatever happens now has a lifelong impact on their psychology. So they've been through this, and I really would request Dr. Rushi to explain to us the impact on children.
Because of the COVID-19 and the lockdown, so because of the kids, the adolescents and children, they were confined to the four wall. I mean, they were confined to their homes only. They were not able to play in the playground with other children. They were not able to go to the schools for some time. Later on, though, the online education got started. So, we have seen that a lot of, mental health issues they faced during this period. The most important part was they were deprived of their normal socio-emotional development. So which was very important part of their development, their growth at this time. And because they were deprived of talking to people, so they were confined to just their homes. So they had many issues. Otherwise also, if we will just ignore this pandemic 19 part, otherwise also, sir, we will see that in the schools, if you will go, you will see at the community level also that the depression, anxiety, psychosomatic issues, eating issues, they are very much common among the adults. So I am not talking about the disorders. So when it comes to the syndromal level, when we talk about the disorders, it has seen in India, it is 10 to 15% of children and adolescents who are having mental health issues at the syndromal level. But in a classroom, if we will see, or in the community level, there are many children who have mental health issues. But as a parent, as a teacher, or as a society, we just ignore that part of the children. So we just need to focus on that part, right? So I think so that fear, that uncertainty and that fear, that has impacted a lot, not only to these children, to their family also. But because this was the time, so I'll just throw some light on the positive aspect also. So because this was the time they were spending time with their parents. So we have seen the parents have reported that they started taking interest in their academics. So like they were playing the role of a teacher, and teachers were also playing the role of a parents. So during the online education also, they were able to share many of their concerns to their teacher, though it was a little bit pressure on the teachers because they were not trained to teach the children from the online education. But I think that's a great achievement for our country also, that they were able to learn through online, the teachers were able to teach online, they were able to take exams online. So somehow we just try to, deal the situation positively also, but that is for sure that because of the pandemic and otherwise also because they have very serious mental health, issues and concerns. That may be, I mean, that is the reason that the substance abuse, suicide, self-harm, all these things are increasing among the children and adolescents also at this age. So I think we just need to make teachers, counselors in the school aware. So the counselors are aware, but because we know that there is lack of, human resource. So we cannot appoint so many counselor or clinical psychologists or mental health professionals in the community or in the school. So the best thing we can do is to train the teachers. So we can train them, we can train the parents. So some workshop can be organized for the teachers and the parents so they know how to identify those mental health issues. Because when we were talking about the stigma also, this is also a myth that people, they don't access mental health services because of the stigma. It's not really the stigma. I think it is also because the most important reason is the lack of awareness about.
They don't know.
Yes,
they don't know.
Yeah. When they come to know, then they neglect, and sometimes it is because of the stigma. So I think these are the major area which we need to address at the community level. Only then we can address the mental health of our children and adolescents who constitute 40% of the population. So if we are taking care of their mental health at this age, if we are looking at their socio-emotional development, we are putting emphasis on that rather than only on the academic part, then only we can save our future generation, I mean the stars of our country from, getting those mental health issues in the adulthood. So we have to really think seriously at this age.
Really important point.
Yeah.
And And I'm glad you brought out the fact that at least in India, we were able to manage online education for vast segments of our population. Maybe not 100%, but a lot of them had access. And just imagine if the pandemic had happened 3 decades ago, probably we would have been really struggling, or an earlier pandemic. So I think all these things have happened. Some link with education has continued, obviously at some cost, but that was probably unavoidable. So we'll come back to that. But very importantly now, Dr. Chadda, that COVID is, we think and we hope, is sort of on its way out. And we are, as endocrinologists, as physicians, we are dealing with post-COVID syndromes of different kinds. We always debate about post-COVID diabetes. So now that COVID is going away, are you still seeing residual mental health problems in patients?
Yeah. Though residual mental health problems may not be that common, but we are seeing some. Basically, I would again say there are two types of people with mental health issues in the background of COVID. One is who lost some of their close relation, and they have not been able to recover from that grief.
The grief is still
and which
there.
has continued as abnormal grief, and has they have developed some kind of mental illness like depression in that background, and which is continuing. And the second group is the persons who developed COVID, and they developed post-COVID kind of syndrome, and some kind of mental health symptoms like anxiety, depression, or multiple aches and pains, or that kind of symptoms that is continuing. So these are the two groups of symptoms. Though gradually people are coming out of it, but these are the two problems which, because during COVID phase we did not see many patients with the mental health, because the mental health symptoms were there, but they were not as severe. Mostly people were able to cope, and there were so many programs also happening, and educational programs, and people were getting some kind of indirect or direct guidance. So, and then because of the lockdowns and restriction on the travel, they were not able to access the mental health services. So only the severe illnesses were coming, and that number was not that big. But in community level, a large number of people, I would say 30–40% were having anxiety, depressive symptoms, because we could see this in the health professionals also, and the caregivers also. So this group was a group whom we can assess in some kind.
So we have a few minutes left, very few. So Dr. Rushi, how should people avoid these mental health problems? What kind of care, as a psychologist, what would you advise, so that we can protect ourselves or prevent mental health issues?
So I think, sir, the most important thing that starts from the basic lifestyle, changes. So I think having a good balanced diet, giving emphasis to the nutrition, and indulging in mild to moderate level of exercise. So physical activity is very important for the people of all ages, right? So apart from that, having a fixed schedule for your eating and sleeping pattern. So the timings for the sleeping and waking should be the same, should be the fixed. So, and that was the basic reason, especially you were talking about the children, adolescents, and even the working class also. So there was basic disruption in the daily routine activities. That was the one thing, that emerged to lot of other mental health issues. So that is one thing we have to emphasize from the beginning, that the sleeping and eating pattern should be fixed, it should be scheduled. Then having good adequate sleep, 6 to 8 hours, having good diet, getting connected with people is very important. So, like Dr. Chadda has also mentioned, that it's not necessarily that if you're having some mental health issues, you will go and access to mental health professional only. I think merely talking to your family and friends is also very important. So sharing and caring, it's very therapeutic. So half of your problems, they just get away when you share your problem with someone. So that is very important. So staying connected with people is also very important. Even in the lockdown also, it was only the, physical disengagement, like we were not able to maintain the physical proximity with people, but while staying at our home, we were able to connect with people through the phone calls, video calls, and there are a lot of social network sites nowadays that people are connected to each other. So there are positive impact also, there are negative impact also. So now a lot of parents, they report that, you know, these behavioral addictions are increasing day by day. So now because of this online education, the children were spending so much time on the screen. So now they have started, you know, playing with the games. I mean, they spend most of their time while playing, remain
it's
on
a big
the
challenge.
So that's a very big challenge. It's true that this mental health issue has emerged. And other than that, yeah, there is one thing that, you know, the parents have reported that because of this, especially in the second wave, you know, our children and adolescents, they have faced or they have experienced those, you know, intense negative emotions of the death of some loved one or the nearby.
Yes,
so they have seen those negative things, what we experience at this age.
Yes.
So that was another thing, you know, which has impacted their mental health, apart from the fear, apprehension, uncertainty and anxiety. So if we can pay attention just to these small things, you know, having some qualitative time with the family. So this is very important for the family members to get aware that if we will spend that qualitative time, if you're spending time with your children, you are talking to them, you are playing with them, you are, you know, enhancing the bonding with each other. So, you know, and you're communicating with each other. So communication gap should not be there. So these are the basic things with the help of which we can enhance the mental health and we can focus on the mental health and well-being of the family members, whether they are kids or the adults. That is required for the people of all ages across the gender.
Self-care by people themselves and the families. In
And
India,
the
families are a very
Yes,
important
sir.
unit. Unlike the West, where sometimes that support is not available, in India it is available. So helping each other within the family is very, very important and an important aspect of maintaining good mental health and preventing mental disorders.
Yes.
Last line to you, Dr. Chadda, because we're running out of time.
Yeah. So I would like to add two more things. Other thing is stay away from drugs and alcohol. Don't resort to tobacco or alcohol to relieve anxiety. Other thing is simple deep breathing exercises, pranayama or some kind of meditation. These also help in relieving anxiety, mild depression, and in fact regular exercise is often called as the best antidepressant or best anti-anxiety. So if you do regular exercise, you have a regular routine of physical exercise, morning, evening walk, and the other thing is deep breathing exercises. They do help in relieving anxiety, relieving mild depression.
थैंक यू. जैसा आपने सुना, जो चीज़ें हमने लाइफस्टाइल में आपसे डिस्कस करी, शुगर के लिए, डायबिटीज़ के लिए, ब्लड प्रेशर के लिए, हार्ट के लिए, किडनी के लिए, फैटी लिवर के लिए, वही सब चीज़ें आपको मेंटल हेल्थ में भी मदद करेंगी. माने हर चीज़ के, शरीर के हर अंग के लिए कोई अलग अलग लाइफस्टाइल नहीं करना पड़ता है. एक जनरल हेल्थी लाइफस्टाइल, सही टाइम पे सोना, सही तरह का खाना खाना, रेगुलर एक्सरसाइज करना. As Dr. Saab said, exercise is the best antidepressant. So I think those are important things that we need to keep in mind when we talk about this. And the other important point is that if there is any sign of mental health issues, it is very, very important to seek help. With these words, we come to the end of this program. Thank you very much.